The Federal Trade Commission is challenging hundreds of alleged junk patent listings filed by several pharmaceutical companies, which regulators claim could increase prices for medications like Novo Nordisk's diabetes drug Ozempic by making it harder to produce generic drugs. The pharmaceutical companies have 30 days to remove or amend their patent listings, or certify under penalty of perjury that the listings meet regulatory requirements. The FTC announced last year it would start scrutinizing bogus patent listings from pharmaceutical companies, which regulators argued disincentivize investments in developing generic drugs. The agency challenged over 100 patent listings in November, including medications for asthma and inhaler devices. 3 companies, GSK, Kaleo and Impax Labs, complied with the FTC's warnings and removed their listings with the FDA. There are no generic alternatives for Ozempic, and there likely won't be a generic form until at least 2031, when Novo Nordisk's patent for semaglutide, Ozempic's active ingredient, expires. 5 companies have rejected the FTC's claim that alleged junk patents stifle competition or prevent generic drug alternatives. AstraZeneca responded to the FTC in February, arguing some of the patents challenged by the agency allow generic drugmakers to better understand the intellectual property landscape they will need to navigate when creating alternative medications. The company also argued its patents were legally compliant, and said at least one generic competitor for one of its medications had entered the market. Teva said it doesn't use patent listings to stifle competitions, prolong a monopoly, or price gouge patients, adding it allows competitors to work around its patents. Teva also argued patent listings were inherently pro-competitive, and a critical aspect of the legal and regulatory landscape. Ozempic belongs to a category of drugs called GLP-1 agonists, which have become wildly popular in recent years for weight loss, though Ozempic is only authorized for diabetes. Supplies for GLP-1 drugs like Wegovy, the weight loss medication by Novo Nordisk, have been severely limited because of increased demand, though some doses of Wegovy are back in stock in the US and all 3 doses are listed as available by the FDA.